Welcome to Nipped in Talks. I'm your host, Dr. Ashley Robey. Today we're going to be talking about arm contouring and brachioplasties. So it's for those who have ever felt like they couldn't wear a short sleeve or a sleeveless top, and for those that have always wanted a little bit more toning in the arms. We wanted to discuss some options that you could consider, and that's things like arm contouring and brachioplasty. So first and foremost, the question is, what is a brachioplasty? That is a surgical procedure to tone the arms, improve contour, get rid of excess skin, all of the above. According to the American Society of Plastic Surgeons, over 18,000 brachioplasties were performed in the United States during the year 2020. That is a 400% increase of what was performed only 20 years prior. So we know from a statistical perspective, this is a very popular procedure. From my point of view, I even feel like over the past several years, I can appreciate that patients' concerns for arm contouring has dramatically increased. When patients come in and ask me, I don't like my arms, I don't like when I wave my arms, my skin continues to wave even though I'm no longer moving my arm. What are my options? So that's what we're going to cover today. We're going to discuss what a brachioplasty is, what some alternative options for additional forms of arm contouring would consist of, who is a good candidate, what you can potentially expect, and we can talk about some of the trends and myths associated with arm contouring. So what are the options when you feel like, hey, my arms could have a better contour, a better shape, a better size? What are some things that I could consider? The one that comes to my mind, and I think a lot of patients' minds first, is liposuction. A liposuction is a minimally invasive procedure that classically involves a few small incisions strategically placed on the arm, ideally so that they're pretty well hidden so you can improve arm contour. Liposuction is essentially a way to remove excess fat through a surgical procedure. The disadvantage for liposuction primarily has to do with the skin status. So if you have already some evidence of loose skin and you're going to solely focus on removing just the fat, essentially you've left the remaining skin the same. So you could have an exacerbation of the degree of skin laxity or looseness. There are some techniques that can be employed to help address this. So those include different forms of liposuction, which we can get into later. There's also a technique that I use pretty regularly, and that's using liposuction and Body Tite. So Body Tite is a treatment that uses radiofrequency energy to tighten the skin. The energy induces a soft tissue contraction. So at around 6 months post-operatively, you're getting around 20 to 25% contraction, and closer to that year mark, the degree of contraction is more like 30 to 40%. So for patients that are thinking, hey, I do have some degree of skin laxity, but I'm not so sure I want to accept the scars associated with a brachioplasty, that can be a really good option. And then finally, brachioplasty itself. So brachioplasty, I would describe as an excisional approach to arm contouring. The traditional brachioplasty scar would be one that's centered along the inside of the arm. That way, when your arm's down to your side, you can't see it from the front or the back. But there are other places where people will hide the incision. The other common one I feel like is just putting it along the backside, which isn't my preferred way, but it's not wrong. There's also a really limited brachioplasty incision where you're just putting the incision in the armpit itself and taking out a wedge like so. That will help mostly just kind of the upper third of the arm. So if all of your laxity is focused on the upper portion of the arm, that could be an option to help address the loose skin. And you may very well want to combine that with some of the other modalities that we were talking about earlier that do help with skin contraction. We already touched a little bit on the different kinds of incisions that are utilized, but with regards to scar length, depending upon what the patient's goals are, what they're seeing from a preoperative perspective, you could isolate that incision just to run along the arm itself. I feel like depending upon how much loose skin is, you may carry it a little bit distal to the elbow. And for patients that have had a lot of massive weight loss, it's not uncommon to carry that incision kind of along that lateral chest wall. So that can be a technique that is utilized as well to improve contour. And for women or men that also have a lot of laxity in their chest, that incision can be even carried underneath the chest wall, kind of in that inframammary fold too. So it just depends on where it is that you're starting and what your goals are and what kind of scar patterns you would be willing to accept or would be reasonable to achieve said goals. So next, Who is a good candidate for a brachioplasty? I would say classically, that's going to be a patient with disproportionately large arms. So if, in other words, if you come in and you say, my arms are big, my neck is big, my chest is big, my abdomen is big, my back is big, my circumferential legs are big. To me, that's you telling me that you, in general, feel like almost every body part is too big. And certainly in those cases, you're going to have the best results if you figure out a way to thin out those tissue layers. This is a recurring theme that I hear from patients, that they'll say, oh, when I get to the BMI that you like, Dr. Robey, I look sickly, I look too thin, especially in my face. And I'll say, well, it makes more sense to me to try to focus in on, let's get as many of your body parts as close as to what you would like. So if that means that through diet and exercise, or some of the new medications that are out there that obviously we could assist you with as well, that you are now more satisfied with your arms and your neck and your chest, et cetera, and it's just one area, let's say the face becomes too thin. I'd rather at that point target the face and try to add volume than to try to remove excess volume from, this many locations on your body. So in general, that's my approach, and I think it makes sense, but it certainly is a discussion I'll have on the regular with patients. So yes, a good candidate for a brachioplasty is someone who has disproportionately large arms, meaning many of the other body parts are close to or within the range of what the patient finds to be ideal for them. But despite that, they still feel like they have too much skin or too much fat on the arms. That's a good candidate for arm contouring. So again, whether it's a minimally invasive liposuction only, or liposuction and skin tightening, or a more traditional surgical approach with brachioplasty and skin excision, those patients would do well with arm contouring. So patients that have specifically excess fat, like we touched on before, they can be a really good candidate for the minimally invasive approach. But once the degree of skin laxity becomes more and more significant, the likelihood that you would want to employ either additional skin tightening in the form of Body Tite or an excisional approach increases. Another good candidate for brachioplasty would be a massive weight loss patient. Those patients have lost a significant amount of weight in multiple body parts, and so oftentimes a brachioplasty is the best way to address whatever residual bits of excess adipose is there, but the significant degree of skin laxity that has resulted from their massive weight loss. Brachioplasty statistics. The global brachioplasty market has experienced significant expansion. In 2022, the brachioplasty market was approximately $1.35 billion, and it is projected to reach $2.32 billion by 2030. I would say this is consistent with what I, again, have seen over the past several years, and that patients and people in general seem to be more in tune and concerned with their arm contouring. One of the other advantages is that as some of the techniques have evolved that allow your surgeon to more effectively address the skin laxity component without relying solely on an excisional component for the treatment, the popularity of this procedure will continue to increase. So that checks out, that makes sense to me. Brachioplasty procedure and recovery. Day of surgery, what is that like? What's entailed? Obviously you are going to be going to either a surgery center or an outpatient hospital. I feel like that's pretty typical. A brachioplasty itself, as an alone procedure, would be an outpatient surgical procedure. I think once you start tacking on multiple procedures at the same time, and if the surgical length becomes too excessive, something above 6.5, 7-ish hours, oftentimes it's considered optimal to have the patient stay overnight somewhere. But if the surgery time can be kept relatively smaller, then I like to have most of my patients go home. For the day of surgery, you come to wherever your surgery is scheduled. Obviously, you're not eating within 8 hours of your scheduled surgery, and I would have already sent you your medication, so you don't have to make a stop at the pharmacy on the way home. You come in, you talk to the nurses, you talk to the anesthesiologist, you get an IV. I like the IVs in the foot because it's just out of the way when I'm trying to operate on the hand, but If you get it in the place in the hand first, that's fine. I will just put one in the foot while you're asleep so that you're not getting two separate IVs. I hear you. I don't love getting poked myself either if I don't have to be. So while you are in the preoperative area, I will do some of the markings that are descriptive of what I'm going to be doing. So in the case of a minimally invasive procedure, it would be usually like 3 little incisions. So I would say roughly smaller than a thumbnail width, like placed here, the kind of the opposite side on the back, and then one in the medial elbow. That's how I like to mark out for my minimally invasive arm procedures. So just those 3 incisions on each side. For the brachioplasty, I like to place the incision so that it's placed in that medial arm crease. And then I'll kind of anticipate where I think the amount of excess skin would be. And then so you'll be able to see those marks. You'll get an idea as to how much skin I'm anticipating can be removed at the time of surgery. Oftentimes the marks are very similar from each arm to the other, but most people don't have true mirror image symmetry one side versus the other. And so I'm certainly taking that into account. And often if the one arm is bigger, you'll find that the marks are gonna incorporate more skin as part of the planned excision so that we can get them as close as possible to each other at the end of surgery. So once the marks are done, you'll go back into the operating room. You'll go to sleep with the anesthesiologist. For me, I try to make it as pleasant of experience as possible. I get made fun of because I'm always playing the spa music and I like to dim the lights. I even like when the little mask smells like something fruity, whatever. I mean, I think it's nice and patients appreciate it. I know that's what, it's just like, what would I want were I in your shoes? And that's what I try to do. Also, classically, the ORs are always so cold. And so I try to have the bed nice and warm. So when you're transferring from your ambulatory bed to the other bed, hopefully it's a little bit toasty. So anyways, you go to sleep. Once you get back to the OR, for any kind of surgical procedure, there's almost like a soap or an antiseptic type of prepping of the skin. So the skin is prepped out, so it's sterile, and the areas that we're working on are draped out, certainly in this case, the arm. And then obviously we always have a timeout and make sure everyone is on the same page about what we're doing and what the patient's consented for, etc. And then the procedure is started. For me, depending again if we're doing the minimally invasive or the traditional brachioplasty approach, I would make the incisions, and I like to pre-tumesce the arm, and that means adding a wetting solution to the arm, which consists of primarily saline, but also a little bit of epinephrine and a local anesthetic to help with blood loss and to provide a nice plane of dissection. So I will do that for the arms. If the arms are already quite thin in the case of a brachioplasty, then I will just use some tools for pre-tunneling, meaning developing that plane. My goal is certainly to minimize the amount of nerve disruption that can be associated with a procedure where you're cutting tissues. So if there is a excisional component to your arm contouring procedure, then the incision will be incised and the amount of excess skin that can be removed will be done so. Then I typically would close the wound over a drain. So the drain is a little piece of silastic tubing that is placed underneath the skin, and that would allow for a point of egress for any fluids that could accumulate in the wound. And those are typically in place with a brachioplasty for under a week's time. The incision is closed in layers, so for me, typically at least 3 layers, technically 4 if you count the layer of skin glue on top. Then I put dressings over the dried skin glue, followed by an arm compression garment. And the arm garment in that situation is usually kind of from one forearm all the way across to the other forearm. It's pretty common for the arms to get quite swollen after a brachioplasty. And certainly anything that is distal to the end of the compression garment tends to get a little more puffy. So this would be, the hands and the distal part of the forearm. And that peak swelling, I would say classically, is around day 3. And so it's helpful to go ahead and try to keep your arms propped up on bed, pillows, or what have you in the beginning, And I would continue to not wear any kind of jewelry while you have that post-operative swelling. From a surgical duration perspective, the average brachioplasty or arm contouring procedure is usually 2 to 3 hours, just depending upon what exactly is done. Recovery, classically, patients are, again, they're wearing that compression garment for around 3 weeks at least, sometimes more if they appreciate a larger degree of swelling. I touched on how I have drains that are placed with a brachioplasty. I don't put drains when I'm doing a minimally invasive approach, i.e. the liposuction or the liposuction with the Body Tite and or Body Morpheus, because the incisions are so small and I don't really have a lot of patients with fluid collection issues in that regard. But the drains would come out again around just under a week's time. From an activity perspective, I like patients to avoid strenuous activity for the first 2 weeks and heavy lifting for the first 6 weeks. It's not uncommon after surgery to experience swelling, bruising, numbness. Patients that are above their ideal weight or that do have a massive history of weight loss where the skin has really been stretched beyond its ability to repair ideally, i.e. there's a lot of stretch marks, they do tend to have a higher risk of widened scars or even spots that don't heal as ideally as possible. So there's a small chance that you could have a little opening along the incision. That's not super common, but again, more common in patients above their ideal weight or with that history. Frequently asked questions. So I would say brachioplasty amongst all of the surgical procedures is associated with a more challenging degree of postoperative scars than other procedures. I suspect it's probably just the extreme mobile nature of our arms and that we as humans are constantly moving our arms. And so that adds another layer of difficulty with regards to wound healing. So they tend to be just a little bit thicker, a little bit darker scars than other scars that are placed elsewhere on the body. Recovery-wise, we already kind of touched on my recommended restrictions, but for the average person with a desk-type job, you could go back to work once the drains were out, so around a week's time. You would still be swollen and probably reduce energy level, but I think functional. If your job has a lot of physically strenuous components to it, you might need additional time before you would be wanting to return to that. Okay, let's see. Next, is the procedure covered by insurance? Rarely. I would say very rarely. The criteria that most insurance companies would require in order to cover this would be things like recurrent arm infections, extreme folliculitis, requiring hospitalizations and IV therapy. So that would be pretty rare. That would be very rare indeed. And so, yeah, it's essentially considered to be an aesthetic or cosmetic plastic surgery procedure and would not typically be covered by insurance. What is the difference between a mini lift and a full arm lift? We touched on that a little bit earlier. That is, are you having an incision placed along the full length of the arm in a full arm lift style? Or are we just limiting the incision to an armpit or an axillary type incision? And so I would say the difference is the length of the scar that you're utilizing. Also, there is a correlation between the length of the scar and the level of expected improvement. In other words, with a small little scar positioned in the axilla only, the degree of improvement or removal of skin laxity would be less than if you were to accept a longer scar. In that case, you can just remove more tissue and remove more skin and have a tighter postoperative result. Okay, can you do just more arm exercises to improve the appearance of your arms? I would say in some respects, yes. So it is possible to go to the gym and really hit the arms and bulk up those arm muscles, whether it's your delts and your biceps and your triceps, etc. But if you have a significant degree of skin laxity, the amount of bulking that would be required would probably be exorbitant, like just too much. You're not going to have He-Man, She-Ra type arms, I'm guessing. So in general, yes, you could bulk up the arms if the degree of laxity was quite minimal. You might be able to account for that small amount of laxity by adding arm muscle. But if it's anything that's more substantial, you're better off figuring out a way to address the actual problem, which is an excess degree of skin. So whether that's a minimally invasive approach in an arm and skin tightening, or an excisional approach where we're just removing the excess skin. Post-operatively, my experience with patients with regards to kind of the emotional post-operative side is that they seem really excited to be able to wear clothes that they've never even considered something that they would put on. So if all of a sudden your arm is tighter, smaller, more toned, it can actually impact what shirts you even buy. I've had quite a few patients tell me that they have to upsize their shirts just to fit their larger arms. So if you can now fit a shirt that fits the rest of your body better because your arms are no longer disproportionately large, I'm sure that's very satisfying. So I do hear that feedback. That being said, with regards to surgery, obviously there are always pros and cons to everything. So if you have a lot of skin and you're considering something like brachioplasty, you would have to accept what I would describe as a fairly large, longer scar in order to remove that significant degree of skin. So if you just have a little bit of laxity, you may not kind of tilt the scales and say, oh yeah, that's worth the larger scar in my case. And then you might find yourself more apt to select something like a minimally invasive approach with a tightening. But if you have so much skin that it's hanging down, then I would say, yeah, I agree. I think removing the skin in a more traditional approach would be worth the scar. In general, risks for brachioplasty are similar to other type surgical procedures. You have a small risk of bleeding, infection, scar, numbness, asymmetry, meaning one side not looking exactly like the other. When scars contract, they can also kind of shorten. So if your scar is so tight, you may feel like, especially in the beginning, that your ability to kind of fully move your arm up could be a little bit restricted. So my goal as a surgeon isn't to create some kind of situation where you have restriction in your movements. I have seen other people have that post-operative results, not my patients, but it can happen. So I think you just have to be really cognizant about removing enough tissue that the contour is good, but not removing so much that you've limited the post-operative range of motion. Yeah, right in the beginning when they're swollen and the scar is a little bit thick, it's not uncommon to feel that the range of motion is a little bit reduced, also just because of discomfort and pain. In my experience with time and a little bit of scar massage, I haven't had patients complain of permanent reduction in their range of motion. Okay, so trends, myths, and hot takes with regards to arm contouring. So what are some of the trendy techniques that by people I mean plastic surgeons primarily utilizing? I just want to kind of go through some of the options that you could consider in more detail. Not every plastic surgeon is going to do every single option, and that's okay. I think you can get really excellent performing one or two different techniques and really tailor your treatment for the patient based on that. One technique that I don't use regularly is the JPlasma or the Renuvion. That, like Body Tite, which I do use, has radiofrequency energy, but also uses partially ionized helium gas for soft tissue contraction. The advantage of the JPlasma is that it does a pretty good job at skin tightening. Around 30 to 50% is what's reported in the literature. There might be like a fairly steep learning curve for the surgeon, his or herself, but the disadvantage is that it doesn't really help with reduction of fat volume, but the surgeon could employ liposuction at the same time to treat that component of the aesthetic concerns. The one that I already touched on next that still falls in the trendy technique is Body Tite, which is the radio frequency soft tissue contraction or radio frequency assisted lipolysis, so fat reduction. Body Tite allows me to use the same little small incisions that I employ for the liposuction. Again, I've talked about the 1, 2, 3 little incisions that I typically would place, and then I would liposuction the area And then the Body Tite will help improve skin tightness, so it'll also induce soft tissue contraction, and it can also be used to treat some of the areas of excess fat. And so the reported degree of skin tightening for Body Tite is around 25 to 45%, so similar to the JPlasma, but also helps with melting the fat. Next, I've used this, so Vaser liposuction. That's an ultrasound assisted liposuction. I've actually used the competitor, like another brand name, the Lysonics liposuction. Again, it's ultrasound assisted. So the idea is that you do get some skin contraction, which is an improvement over just traditional kind of mechanical liposuction, but the degree of skin tightening is around 5 to 10%. So I did use the ultrasound assisted liposuction before I had the Body Tite for patients with skin laxity, because I thought, well, yeah, 5 to 10% is better than nothing. But with the new technology, I add the Body Tite as my minimally invasive tool for additional skin tightening. Also, when I do Body Tite, I also use Body Morpheus. So that is radio frequency microneedling. So the idea behind microneedling is that with every little poke of a microneedle, you've created a little micro trauma. And so your body responds to that trauma by bringing in inflammatory cells, improving collagen content and elastin content in the area. And when you also add a pulse of energy, in this case, radio frequency energy, you get that same kind of response, but an order of magnitude greater. So just that much more skin tightening as compared to just microneedles without the energy added on top of it alone. So next, mini brachioplasty. Again, that's the incision that's positioned within the armpit or the axilla. It's a smaller incision, so less to heal from. And I think it's nice for patients that only really have loose skin in the upper arm. I would say I don't feel like that's typical of most patients. Most people have laxity that extends along the full length of the upper arm, but for those patients where they're really primarily concerned about the upper arm, I feel like you could use that in combination with some of the minimally invasive techniques if you're really trying to avoid that longer full arm length incision. The other instance where I do like to employ that axillary type incision, it's not so much arm contouring, although it's kind of in the axillary junction. It's for people that have accessory breast tissue. So the breast gland, for those of you that don't know, has this what's called a tail of Spence. And so there's breast gland that's kind of going up all the way towards the armpit. And it's not uncommon to have a sizable deposit of breast gland in the axilla. And so for some women, it can become quite full. Like it can look like there's a big mass or fullness in that armpit area. And for those women, and it can be something that also fluctuates with hormones, like gets bigger and smaller based on menstrual cycles too. And they really hate that fullness, and they will avoid wearing tank tops or anything that shows off that area. So yeah, I think for those patients, adding that axillary scar and removing the accessory or the extra breast gland there, and also often involves removing some of the excess skin because the skin overlying that accessory gland gets stretched out. That is definitely worth it. I've had a lot of really good results with that, and I think it's well worth the scar. Cool sculpting for arms, that's not something I do. I know cool sculpting was really popular for a while there. So it's cryolipolysis, the idea being you're freezing the fat away. You make the fat cells non-viable by freezing them without disrupting the overlying skin. And then your body absorbs the non-viable cells and then excretes them. And so you get a net reduction in the total amount of fat. The primary downside of cool sculpting is that it's not addressing any kind of issue with the overlying degree of skin laxity. Per cool sculpting session, maybe you're getting around a 20% a reduction of excess fat. But it's not going to be tightening the skin. So that's my a major downside for that kind of technique. One thing I haven't seen a lot of or haven't heard a lot of buzz about is the suture suspension arm lift. I know that that's popular in the face and neck, and I think it can be okay. Mixed results, like maybe the longevity of those techniques isn't great, but it is very minimally invasive. So when you're comparing it to something like a facelift, obviously it's very different to just walk in and have some suspension sutures placed and then going home versus having a facelift. So there is a correlation between the kind of results you can expect and some of the downtime associated with those procedures. So yeah, I think that same kind of technique can be employed in the arms, and I would describe it as something that could maybe give you a mild improvement in the degree of loose skin, probably from a long-term perspective isn't going to be as effective. High definition arm sculpting, that's going to be a form of liposuction. I know we've talked about this in previous episodes where you're trying to sculpt the arm. So you're not just thinning out the layer of fat into a uniform layer of fat. You're trying to accentuate underlying musculature. You're leaving more fullness on the deltoid and you're leaving more fullness along the bicep to try to create the illusion of a really muscularly sculpted arm. Of course, the difference is with high definition sculpting is that it's not muscle, it's fat. And so those can look really good initially, but with fluctuations in weight, given that it's an uneven and intentional uneven layer of fat that's left, it can really be variable with regards to the longevity of those quality results. So I'm not really into it. I'm not a huge fan. I think it, again, can look good transiently, but if you want bulky muscular arms, I suggest you try to bulk the muscles as opposed to leaving large deposits of fat to look like fake muscles. And then finally, laser assisted liposuction. So this is another technique that utilizes liposuction with an added energy, in this case, laser. Smart lipo is another name for this. It's basically you're adding energy to help melt the collagen and stimulate the fat. I would say that this is about 15 to 30% skin tightening, so not quite as much as the JPlasma and or Body Tite with regards to overlaying skin tightening, but I think something that, you know, when you're thinking about someone that has some skin laxity and they want liposuction, that it can be a technique that can be employed to help improve the degree of loose skin at the same time as removing excess volume in the form of liposuction so that the patient doesn't end up with a worsening degree of skin laxity. Okay, so is it worth it? Is a brachioplasty, is arm contouring worth it? So the average brachioplasty expense is around $7,000 to $13,000. So worth it is a tough kind of assessment for me to make generally. In my experience, the patients that I do it on would say yes. That being said, I'm not doing brachioplasties on someone, I'm not adding a big scar on patients that have no loose skin. So I think a lot of getting good results is also about appropriate patient selection and making sure that what the patients are expecting from an outcome perspective and a scar perspective is in alignment with what you can provide as a surgeon. But the satisfaction rate for brachioplasties is around 80 to 90%. So overall, it's quite good. So key takeaways for arm contouring and our brachioplasties. Pros, with a brachioplasty, you will have less skin, less fat, a tighter arm for whatever muscle definition that is there natively, that you'll be able to see that better because there's less loose skin hanging over the muscles to obscure them. Cons, certainly the scar that's associated with the brachioplasty and some numbness. So ideally, if there is numbness, it would be transient, but there are going to be some sensory nerves that are cut. The ideal plastic surgeon isn't going to be cutting some of the main sensory nerves that could result in permanent numbness, but having transient patchy numbness, especially around the incision where we've disrupted some of those nerves intentionally just to remove the excess skin, would be anticipated to some degree. Brachioplasties are not for everyone, but can be life-changing for the right patient, for patients that have a lot of loose skin and or have disproportionately large arms. For those patients that don't think the scar is worth it, some of the minimally invasive techniques like the liposuction by adding Body Tite or the JPlasma or whatever the technique of preference is, for some of the additional skin tightening. And like I said, I even add the RF microneedling to add additional skin tightening at the time of surgery. I think that's a really good option too, and I've had some really good results with that. So if you have some loose skin, but not so much that you're like, hey, yeah, I want the thing where you add the scar down my arm, I feel like some of the minimally invasive options would be a good choice for you. So if that's something that interests you, or if you want to know more about if you're a good candidate, the next step would be finding a plastic surgeon if you're not too far from me. I'm in Carmel at Robey Plastic Surgery. But otherwise, you can certainly look for board certified plastic surgeons in your area and seek consultation to see if you're a good candidate for the traditional brachioplasty and or other forms of arm contouring. For those of you listening, if you have questions or ideas for further episodes or stories or pressing topics that you would like us to discuss, please feel free to hit us up at www.niptontalks.com. Thanks for listening, and we'll see you in the next episode.